thank everyone to come to Grand Rounds today. I just wanted to make a quick announcement that this is part of the Max Bleicher Endowed Lectureship Series. This is through a planned gift nearly 30 years ago to the department in honor of his parents, Sam and Pauline. So we have this biannual lecture series, and I'm very happy that Dr. Latha Chandran will be here. I've worked with her over the past few months, and it's been a great experience. So Philip will be introducing her. Thank you guys for coming.
Thank you, Dr. Deshpande. It's my pleasure to introduce Dr. Latha Chandran, Chair of the Department of Medical Education and Executive Dean for Education and Policy here at the University of Miami. Dr. Chandran received her medical degree at Kerala University in India, where she also trained in obstetrics and gynecology. Upon moving to the United States, she pursued residency training in pediatrics at New York Medical College and ultimately Stony Brook University, where she completed her residency and chief residency in pediatrics. She joined the faculty at Stony Brook in 1992, where among other appointments, she served as Director of General Pediatrics for 10 years and was Distinguished Teaching Professor and Vice Dean for Academic and Faculty Affairs. Dr. Chandran is a national leader in pediatrics and medical education. She's the President of the Academic Pediatric Association and Treasurer of the National Board of Medical Examiners. She's co-founded faculty development programs, which to date have graduated well over 100 junior pediatric faculty nationwide. Dr. Chandran joined us this summer as the founding chair of the Department of Medical Education here at the Miller School of Medicine, and we are honored to have her speak to us today about AI-enabled medical practice.
Thank you, Philip, for the kind introduction. Can you all hear me okay? Good, thank you. So good afternoon, everyone. Thank you to the department for inviting me to give this Grand Rounds. So my topic today is AI-enabled medical practice. Are we ready for it? So let me start off by saying I have no conflicts of interest to declare, and I am not an AI expert, but I am just AI curious. And my first interest in this topic really emerged when we were at an executive board retreat of the National Board of Medical Examiners. As Philip said, I serve as the treasurer. And we were talking about, how does the future of medicine look like in the next 20 to 30 years. And we discussed what that means for physician assessment. And all of a sudden, I had all these ideas in my head. So on the way back from Philadelphia to New York, on my phone, I started writing down some of those ideas and read more and found more about it. And I will tell you, we finally ended up being a publication. So the objectives of today's session is to discuss the 4 waves of artificial intelligence and to list some of the current applications of AI in medicine, and for us to consider, analyze the role of AI in the future practice of medicine. And then from a medical educator perspective, evaluate the current training and assessment practices for preparing physicians for future practice. So when we think about the industrial revolutions, historically, we all know that the first major industrial revolution happened with the railroads and the steam engine. That was in the 1700s. And moving on, the second industrial revolution happened with electricity and mass production around in the 1800s. And around 1960 or so, the third, 69 to be precise, the third industrial major revolution happened with electronics and computers. And this is where we are, the 4th industrial age. So what is artificial intelligence? The theory and development of computer systems able to perform tasks that normally require human intelligence, such as decision-making, speech recognition, visual perception, and translation between languages. And we can all relate to some of these, right? When we are sitting in our emergency rooms or hospitals and using these decision support tools, we are using AI. So from 50 years ago, here's a prediction. Computing science will probably exert its major effects by augmenting, and in some cases, largely replacing the intellectual functions of a physician. This was by William Schwartz in 1970. And when you think of it, it is sort of threatening to us because we as physicians pride in our ability to accumulate a lot of information, synthesize it, and provide care based on that information, right? So has that happened? Now here is a comment from Sundar Pichai, who's the chief of Google. AI is probably the most important thing humanity has ever worked on. AI is more profound than electricity or fire. Just think about it for a moment. That's a profound statement from somebody who knows something about AI. So let's just look at the history of AI. So the term AI was coined by a guy named John McCarthy in 1955, long ago. And in 1997 is when people started paying attention to it, because IBM developed a machine, Deep Blue, which beat Garry Kasparov, who was the world's chess champion at the time. And what Garry Kasparov writes is that when he was playing against this machine, he could sense a new kind of intelligence across the table. And playing something against something with no psyche was troubling from the start. Now, that was what we call narrow AI. Based on what was fed to it, it will act, right? There was no learning from activity. It was just a rules-based application. So that was narrow AI in the 1990s. So AI 101, there are 4 waves of AI that we can think about. Internet AI, business AI, perception AI, and autonomous AI. And these waves, so one of the books that I would recommend for those who are interested in reading more, one is called The AI Superpowers, China, Silicon Valley, and the New World Order by Kai-Fu Lee. He was the president of Google China. And it's actually quite an interesting book comparing the AI advances in China and the US, as well as what the future is going to look like. Very interesting book. So the internet and business AI, internet AI we all do. When we go on Google and search for artificial intelligence, it will know what we are thinking about and give us suggestions. That is part of the internet AI. Business AI, the US is very, very strong in this, using algorithms on existing databases to optimize decisions or results. We do really well in this. And it's particularly used in financial sectors for AI-powered microfinance and so on. So those are the sort of early AI models. Perception AI is where things start to get a little crazy for us. And this is already happening. Perception AI blurs the line between the physical world that we know of and the digital world that we experience sometimes, right? So right now we have a separate online time and an offline time. And as perception AI becomes more and more prevalent in our homes and in our shopping centers, it's merging. So they call it OMO, online merge offline, OMO. And visual perception, we are all familiar with Google Glasses, with Facebook's facial recognition profiles and all that. It comes under perception AI. And in China, there's this company called Alibaba. They have a program called City Brain. They have looked at actual patterns of traffic using multiple cameras and figured out exactly how urban traffic flows are operationalized. And they can recognize objects similar to how our brains can recognize a face or a pattern. And to a point where when perception AI is fully developed, it will know when we go to a store, the shopping cart can actually know your name, can actually know what you don't have on your fridge and suggest this is a place, this is the aisle you need to go, this is where there is a sale for this particular item that you need. And so hospitals and kitchens will become OMO environments. It's kind of scary when you think about it. Autonomous AI is the most scary, but it is coming. So it's the last wave to come. And this is considered to be more of a tsunami than a wave. In this situation, when we have autonomous AI, machines just don't understand the world. They actually will shape the world. So we all know about automatic cars. Most of us have automatic cars. Some of us have started looking at autonomous cars. What is the difference? We'll talk about that, right? And when we have autonomous cars, there are different levels of autonomy that we can allow a machine to do for us. And within those levels of autonomy, there is some ethical decision-making involved as well. So in other words, when we have more and more of autonomous AI, ethical decision-making is delegated to the machine. That's kind of scary. So here's an example of a car, autonomous car that makes decisions on its own. When the car sees a bunch of passengers walk by, pedestrians walk by, it has to make a decision whether it's going to turn and destroy one person or it's going to go straight ahead and kill all these people, right? Or a pedestrian walking in, it has to make a decision whether it's going to destroy the driver of the car or the pedestrian, right? So those are the kind of things that we are, a single person or multiple people, right? So that's the kind of decision that the machine will have to make independently. So this is from Kai-Fu Lee's book. So where are these four waves of AI right now, where China is and where the United States is? And this is estimated in 5 years where we will be. And according to Kai-Fu Lee, the prediction is that in perception AI, China is going to be, 8 to 2 is the comparison between China versus the US, whereas in autonomous AI, where China is much less advanced now, they think it's going to be probably 1-to-1 proportion. But that is sort of a scary thought, but that is the truth. So I want to move on to what is called deep neural networks. And it is really when these four advances came about that we were able to really make a significant jump in our AI capabilities. So these four advances are, we now had big data sets for training and understanding, for training machines and understanding. We also had dedicated graphics processing units. And then we had cloud computing, right? Now we could store massive amounts of data. So we could use massive amounts of data for training. And then open source development of algorithms became very common. So these four advances made deep neural networks possible. So what do I mean by deep neural networks? It is identical to our neuronal structure, right? So there's an input layer, and you can think of it as our sensory organs. And there are many hidden layers of learning. And then there is an output layer. I will show you a picture so it's a little bit clearer. So this is an example from the book of what a deep learning neural network looks like, right? So this is the input layer. You can think of it as our 5 senses, if you will. And there's a whole set of, and again, depending on how deep this hidden layer is, the more complex the AI structure can be. And this is the output. So based on the input and based on all these hidden layers, they make decisions, connect, and then decisions are made for the output. This is the deep neural, or deep learning as they call it. So the deep neural network history in 2015, very recent, if you think about it, it's like 5 years ago, right? DeepMind, again, I believe an IBM product, beat the classic Atari video game Breakout. So that was like a wow. And the strategy that this particular computer program used to play was unknown to any player so far, until they learned it from the AI that they had built. So they had built this machine, this algorithm, and the leader of DeepMind, Demis Hassabis, says that he did not know that this particular strategy was even possible. And that was one of those special moments when they're realizing, oh my God, right? This machine is actually smarter than the person who made the machine. More recently in 2016, I was made aware of this by my son, who's a geek in this area. So there was this product called AlphaGo, and this AlphaGo was AlphaGo was playing this game Go, which is a very popular game in China and Korea, and the world champion at that time was a guy named Lee Sedol. So this was happening. It was midnight here. A lot of people here were watching what was going to happen. And AlphaGo actually beat Lee Sedol, which was very surprising, in a really record time. So China woke up to this at that time and said, they call it the Sputnik moment in China, where they said, we have to really invest in this technology because this is going to conquer the world. So what did AlphaGo do? It had a very special move 37, which was the key winning move that no human had ever done or even thought about. It was a highly creative, it was completely machine made, and was made in defiance of human wisdom. So humans would not have made that move, but because it was so much more intelligent than the human, it did that. And subsequently, they developed an AlphaGo. This is by Alphabet, that's why it's called Alpha. AlphaGo 0, given the basic rules. It was just given the basic rules of this game Go. It self-taught the game. And within 4 hours, it played at champion level. So just think about it, right? We talk about 10,000 hours of practice for us to become an expert. This AlphaGo 0 did that in 4 hours. Mind-boggling. So what are some of the advances in medicine with AI? So there is this iRhythm Zio band aid-like patch to capture heart rate rhythms like a Holter monitor. Very, very simple patch, right? There is an Isabel symptom checker. Some of you may be familiar with this. It covers more than 6,000 diseases that you can check in a heartbeat. Boy Health uses a differential diagnosis using 18,000 publications and data from millions of patients. So these are some of the critical tools that we can use today in AI. So the other book that I want to introduce you, if you are really thinking of AI in medicine, is this Deep Medicine book. This is by Dr. Eric Topol, who's a cardiologist, and it says how artificial intelligence can make healthcare human again. And I was particularly interested in this book because, as I said early on my way back from the NBME, what I wrote in my phone, I developed into an outline for possibly a paper, like a prospectus paper. And my argument was that no matter how much AI advances, that we need to have caring, compassionate physicians to provide the care. And when I saw this title, I'm like, ooh, that may be exactly opposite of what I'm thinking. So let me read this book. And it was not the opposite. It was exactly reaffirming of that initial idea. But what does he say in Deep Medicine? So this is where we are right now with our intelligence and our abilities, right? We make 12 million significant misdiagnoses per year in a 2014 study. So some of these include not ordering the right test, interpreting the results of a test wrong, improper differential diagnosis, or missing an abnormal finding. Lancet papers from the Right Care Alliance in 2017 says as much of 60% of the procedures in the United States currently are unnecessary procedures. And we can relate to some of that. Physician burnout doubles the risk of patient safety incidents, 2018 study. So the results are waste and harm. So can we do better? So he calls this shallow medicine, looking at the number of patients we need to treat for a particular drug, right? A patient comes in with a heartburn, we give them Nexium, and it requires so many patients to be treated for one patient to get the benefit. But we give them all the same thing. Whereas if you look at schizophrenia, it's a much smaller number. So clinical responsiveness is not the same for everybody. And we don't think about that. So algorithms, right? So the machine learning algorithms, they exist as a continuum. So the continuum starts from entirely human-guided processes to entirely machine-guided autonomous processes. And deep learning is at the far end, machine end of this scale. And we can decide where we want our algorithm to stop. And autonomous AI, when you think about it, right, we can't get the car to decide everything. So at some point, the level of autonomy has to be controlled by humans. So again, another slide on human versus the machine. Some people think the machine is not as good, but you can see how quickly, this is the last 10 years, right? Human performance was here and the best AI systems. And by 2017, 2018, AI is at least as good as, and I am certain in the next decade will be significantly better than any human performance. So what are some of the potential applications of AI in healthcare that could happen in the future? Drug development. I didn't have a chance to look it up, but last month or a month before that, there was a new drug that machines figured out how they could put it together based on deep learning. Diagnosis of diseases, analysis of health plans, monitoring of population health, digital consultations, which we have, thanks to COVID, now started doing. Surgical and medical treatment, managing medical data, as well as precision medicine. All this is possible, potential AI applications in healthcare. So current applications, there's a lot of, in the literature, I have references in the end for people who want to look it up. So in all of these fields, AI has been found to be superior to trained doctors in radiology, pathology, dermatology, psychiatry, cancer care, and ophthalmology. And really, for reading patterns, that's really the sweet spot of AI. They are so much better than human beings. And if AI becomes fully implemented, more than 40% of the healthcare jobs can be automated. Scary. So here are some more examples. Interpretation of CT scans for strokes. Yeah, the machine did better than trained experts. FDA has actually approved this particular AI called Contact CT AI to read CT scans, totally machine-read CT scans. EKG readings, again, early detection of melanoma, Stanford study. All of those are already proven to be superior to human. Going further, quantifying bone age. These are all recent studies. Classification of lung and brain cancer slides. 30-second EKG readings better than the cardiologist. Continuous glucose monitoring, predicting heart disease, and diagnosing colonoscopy images correctly. In ophthalmology, these are some of the applications. Macular degeneration, it can make a diagnosis early. Diabetic retinopathy, retinopathy of prematurity, congenital cataracts, and so even a smartphone app that allows you to do retinal self-exam for those people at risk for retinal detachments or retinal hemorrhages can now have an app in their smartphone that will allow them to screen. And a few more diagnoses, identifying critical gene mutations in colon cancer, brain cancer, hepatic masses diagnosis of lung nodules, 2018, breast cancer from mammogram images, and IBM Watson. So it could be in the future that instead of one of those actual human beings, it could be Dr. Watson could see you and make a diagnosis more precisely than a person. How about mental health, right? This is where people believe that AI is going to be really, really critically important worldwide. Interesting, humans prefer to trust machines with their innermost secrets instead of other human beings. And this is in many places. So there are these chatbots, machines that connect using natural language processing to humans, and humans are talking to machines, and they are giving you therapy and diagnosis and all that. Even in the US, over 8 million people have used Cleverbot, which is again one of those AI for mental health in just 2017 alone. Wobot is another one from China. In the first few months, this particular one has had more users than a psychologist practicing 100 years. Think about that impact. We all complain that we can't get enough mental health help for our patients. So this is where I think it's going to make the biggest impact. So here is another one for diagnosis, right? Unsupervised deep learning with 700,000 patients from a hospital. The machine was able to predict the probability as well as the timing of onset of schizophrenia, which is a very difficult task for human beings to complete. It can also, just from looking at Instagram pictures people post, it can predict the risk of a suicide attempt. Pretty profound when you think about it. So continuing with AI and mental health, there is a commercially available tool now for primary care physicians to diagnose schizophrenia, a bipolar disorder, and depression that works on Amazon's Alexa. There is a program called Deep Mood that can track a person's mood just by how you strike on the keyboard and predict depression. Again, Instagram photos, you can just look at the facial features and make a reliable diagnosis of depression. And using voice analysis, recognizing PTSD among veterans. These are all in the past 5 years data. So this is a picture of the Instagram, how people use filters in Instagram. You can easily see that the pattern between healthy people using filters and depressed people using filters are very different. So the machine can easily identify who among the Instagram users is depressed. There's a talk therapy that's possible for depression using a smartphone app. There is a meta-analysis involving 18 randomized clinical trials showing significant improvement, especially cognitive behavioral therapy-based ones, again, published in 2017. So here's a study looking at in-person CBT versus robot therapy, right? The virtual counselor had better engagement and reduced depression than an actual cognitive behavioral therapy. And we believe that this could become one of the most important booster functions in AI of medicine. So this is what they call digitizing the mind and digitizing the phenotyping of behaviors that we do. Pretty scary. And within health systems, AI can also be quite helpful. They can predict which patients in the critical care units are going to die based on some EMR data. Just 90% accuracy of predicting death. That's not bad. 83% accuracy in predicting who is going to come back after you discharge them based on the data available in the EMR. It's also helpful in determining the optimal time of transfer out of the ICU safely so they don't have to be brought back to the ICU. It can also improve patient safety and efficiency. And University of Washington actually uses this program called Germ Watcher to make early detection of nosocomial infections. Telemedicine and virtual hospital. So this was, I made these slides before COVID. So telemedicine, now everybody has started using it, has applications across many specialties, and it's expected to make a huge impact globally in psychiatry. And in 2015, actually the US saw the opening of a virtual hospital. So this is the Mercy Hospital Virtual Care Unit, where they actually don't have any patients in-house, but it's longitudinal patient management with many virtual interactions regularly. So they call it the touchless warmth. And in hospitals, robots are delivering food and medications for patients as well. And as we said, they can predict disease progression. So lots going on in virtual worlds as we speak. So here is something that I found in one of my emails. Tele-ICU arrives in rural Virginia. There are many parts of the country where we don't have enough qualified physicians, and here is an example, right? Winchester Medical Center now just has a single intensivist on site at night who is charged with overseeing any admissions, emergencies, or procedures. And this advanced ICU care company remotely manages patients via video and audio equipment. And the team has nurses and respiratory therapists and has access to the electronic health records. And across all of rural Virginia, they're doing tele-ICU. This is a picture of that team. This is how that team works. Remote monitoring of patients. So these were some of the possibilities with AI. What are some of the challenges with AI? So people who work in this field are concerned about how rapidly and how quickly the AI has emerged as a real force that is better and superior to our intelligence. So Kathy O'Neill calls it weapons of math destruction. Unfortunately, algorithms, bias is embedded into our algorithmic world. So we all know about Google's photo AI app mistakenly tagging Black people for gorillas. And therefore, the potential for AI to exacerbate existing substantial economic inequities is there. So in 2015, UK's National Health System transferred all its patient database into DeepMind, which was a Google subsidiary, without patient consent. Just imagine that. Who owns that data? And we all know about the Cambridge Analytica and Facebook data extraction of user profiles. So some of the challenges potentially that could happen is that AI could be used to categorize patients based on their health risk. So what does that mean? If I carry a particular gene, I'm at risk for a certain cancer, it's potentially insurance companies can use to give me a bad rate, right? Preferential insurance rates or treatments. Potential genetic discrimination. If all of my information, all of our information is stored in databases and people can figure out that, I'm at risk for a heart disease, insurers could say that I don't want to insure you, or employers would say, I don't want to employ you, right? So here is Stephen Hawking talking about AI. AI could be the worst event in the history of our civilization. So it is really, truly a double-edged sword. So what about open AI? So this is sort of where people who want to do good things with AI is thinking about, right? So imagine right now when the machine did that particular move, nobody knew how the machine learned it. How did it do that? So if we can know how it does what it does with the data available in an open format so people can see it, then it's a little bit more comfortable for people, right? We talked about this potential for automated drug discovery, which has already happened, I know, potential new treatments. And then there's whole conversation about diet. In Deep Medicine, the book, he has a whole section on diets, right? We talk about the glycemic index and the different sorts of diets. But again, because we are all individual, and there is some data in there that's saying that eating the same food, the glycemic index varies between individuals. So a universal approach to a diet doesn't work, but we could have deep diets using deep learning that works for each of us, right? And we could easily have robots as our virtual medical assistants. So when you look at overall, is it good or not good, right? There are advantages, there are disadvantages. Disadvantages, loss of jobs. What are all of us going to do because if the machines take over everything? What about lack of human touch, empathy, and emotional intelligence? Are the machines going to have that? We don't know. But we do know that from an efficiency perspective, accuracy perspective, precise medicine for people, potentially increased face time with patients, increased time focused on critical patients, it could be better for all of our patients and maybe for all of us as well. So now moving to, if this is the direction in which AI is going to go, what will the role of a doctor be, right? AI is going to make possible precision medicine. So when a patient sits in front of you, AI can tell you exactly what the right medication is for this particular patient's hypertension. So we can tailor the treatment to patient's diagnosis and to the unique characteristics that deep learning algorithms use to optimize therapy. So that is good. How do we make it happen? So what would the attributes be of the future physician in this AI-enabled world? Clearly, there'll be less emphasis on cognitive skills because the machine is going to have more cognitive skills than the human, but there should be more emphasis on critical human skills. And what I mean by critical human skills are emotional intelligence, situational judgment. So based on the context of the patient that's in front of you, even if the AI says something, you may make a different decision based on the situation. Collaborative and team skills, active listening to the patient's concerns, as well as context-appropriate communication skills, professionalism, empathy, and compassion. So all of these things are what I call critical human skills, which we still need because the machine can't do that, at least now. So Eric Topol in his book talks about, we have prized brilliant doctors for decades, but the rise of machines will heighten the diagnostic skills and the fund of medical knowledge available to all clinicians everywhere in the world. This leveling of medical knowledge landscape will ultimately lead to a new premium to find and train doctors who have the highest level of emotional intelligence. So we move to us becoming a compassionate caregiver. What does that mean? It may be combining the skills of a nurse, a social worker, a medical technician, and a psychologist. And the human, the doctor, would be a perfect complement to the machine. So there would be a symbiosis between the human and the machine. And perhaps caregivers can be drawn from a larger pool. Maybe our training will be less expensive, but a larger number of caregivers, resulting in better care for patients overall. So there is no limitation with the number of caregivers. So AMA, how is AMA reacting to the AI advances? This is what the AMA says. It's encouraging accrediting and licensing bodies to study how to address AI based on accrediting and licensing standards, right? And we should develop these educational modules related to AI, and also encouraging the study of how differences in institutional access to AI may impact disparities in education for students, as well as how disparities in AI educational resources may impact healthcare disparity for patients. So they just want us to start thinking about how this can be studied so we know what to do. So what will the role of educators be in this? This is my medical education hat. So I think what, as medical educators, we should be doing is developing and deploying the right tools to assess those critical human skills that we talked about earlier, and figuring out ways to select trainees based on their human skills rather than their cognitive skills. And then developing assessment strategies to determine who qualifies to be the best compassionate caregivers. And this is where the NBME conversation was, and we are far from it, but certainly many people are thinking about it. So right now, most of our assessment strategies, as you all know, all of our standardized exam test cognitive skills. There are some communication skills testing, very few test situational judgment skills. And right now, there's a wide void of standardized, reliable measures of critical human skills. There have been improvement in natural language processing apps. So the way you write a note, the way you write your reflection can be analyzed for some of these features, but we are very, very early in that process. So I didn't want you all to think that AI is all bad. We can imagine a bright future for AI, right? So imagine this future. A doctor walks into the patient's room. Siri reminds the doctor of the issues from the last visit that's pertinent. And Siri just silently listens in on the conversation between the doctor and the patient. We just keep talking to each other rather than looking at a computer as we do right now. And Siri then generates an organized note for our final review. We can, and then as we are talking, Siri is taking care of all the orders and the recommendations after our discussion. And then Siri sends that information to the patient portal and the patient digital devices, as well as reminds the patients on follow-up. So this is a possible scenario that could happen with use of AI. So I wanted to say that my outline, I was sitting with my outline and I had asked Peter Katsouforakis, who is the CEO of NBME, if he wanted to write this paper with me. And he said, sure. We wrote the outline, but didn't have time. And sure enough, a fourth-year medical student comes to my office. And I said, do you want to be the first author on a paper with me? And he said, sure. And together we wrote this. It's available online in academic medicine. The title is Technology Can Augment, but not replace critical human skills needed for patient care. These are the references that I used to make those claims. And I am now open for any questions, comments, and thank you for your engagement with us.
Thank you, Dr. Chandran, for your very thought-provoking and informative grand rounds. We're very grateful to it. I'd like to ask your opinion about when we train medical students, when we now use genetics and understand genetic information to understand diseases. It was very important during the course of the medical students' training that they understood the basics of genetics, because without understanding what genetics is all about, you really can't understand the information that you're given about it. And the same thing is true for AI, because as we develop that, it's one thing to be able to Google search something and up to date, or search something in a other reference, but to truly understand the pathways that are involved in AI, it really behooves the medical student to have training in understanding the systems that are used to develop it so they can understand how to utilize that information. So what I guess I'm getting to is, in our next gen curriculum, as we think about preparing the world for AI-related medicine, are we training our students on how to understand AI, not how to use it? That's relatively simple and can be done almost by anybody, but being able to understand the thought processes that go in, because these computers are only as smart as the people that program them.
Agree. Again, with deep learning, the computer can be smarter than the person who programs it. That's the idea. As long as there's a lot of multiple layers, it can learn on its own. However, your point is very well taken. Information science should probably be part of the medical school curriculum. And it's funny because I was just talking to somebody yesterday about how engineering and medicine should come together for some of these things. So we don't have that quite in NextGen MD, but this is just the beginning of that process. But I think in the future that will become a reality in most medical schools.
I know you're probably too young, but when we used to have Index Medicus as our only source of reviewing the literature, nights would be spent in the library going through yearly editions to be able to find the right case report that would reflect the patient you're about to present in the morning. We've come clearly a long way since then. I think we should open the floor to discussions, and
this is
anybody?
Do you mind if I ask a question, Dr. Chandran?
Please go ahead.
So thank you so much. This was a very interesting talk, and actually one of the areas that I'm very myself personally interested in. One of the challenges that I see with AI in our current health system is that even though we have EMRs, our EMRs are not designed that to easily interface with any deep learning, machine learning kind of system. I'm learning that firsthand as I'm going through the EMRs with our COVID data. And some of the challenges that we have when we look at our machine learning algorithms for that is that it comes up with interesting finds, which absolutely make no clinical sense, not because the algorithm is flawed, but because the input into the algorithm has many challenges and we're missing a lot of data. So, and I think any smart health system, and this is not so much a question, but also your comments would be very welcome. Any smart health system, and knowing that AI is here and definitely going to be more so here in the future, needs to start changing its inputs into any kind of machine learning system and interfacing the EMR and all the various inputs that we have when we do all the measurements with our patients, so that we can start taking advantage of the technology that currently exists and then build on it for future technology. So when you bring a computer scientist into our medical arena, they are very unhappy because they need variables, they need data, and the data does not speak to them in a great way currently, the way we have our system set up.
Well, unfortunately, our EMR systems are really billing systems, optimized for billing, not for patient care. So the scenario that I told you where Siri just is silently in the room and we actually have the conversation is a patient care oriented design of AI. But then who funds that one, right? And the other thing that is really concerning in this is that these large companies now own trillions and zillions of data points, and they get to control it because it's all now hidden, right? So how is this spread and how is this operated on? So that's why the open source becomes so important, that people can see there's transparency in how it is, but it won't become because, you know, and even in China, and the future prediction is that there will be like 5 or 6 companies that will own 80% of the world's data. And that becomes an issue.
Absolutely. One of the interesting things with AI is looking at Twitter feeds and people's Facebook presence. As you said, they come up with depression or PTSD, et cetera. But it also has been used to really look for hotspots for outbreaks of various infectious diseases. So the patterns that the machines can pick up is very fascinating. But I think the input of data becomes a huge problem.
Anyone else? Well, I thank you very much, Dr. Chandran, for being present at our Department of Medicine Grand Rounds, and we look forward to further interactions with you in the future. Everyone, please be safe, and thank you for coming today. Have a nice day.
Thank you so much. Take care.